So good morning, everyone. We are going to start today's session. So could you see? I think few participants they missed yesterday's session. So we have shared the video, and I hope they must have seen, or maybe they'll see during this week, so that they can catch up with the left portion and the concepts which they have not understood. So I'll start sharing my screen. Can you give my sharing rights? So I'll start. I think Ashwati yesterday asked regarding the why there was a error term at the construct level. I think it was Ashwati because she said that why the error term is there at the each item level in the reflective scale and why it is there at the construct level in case of a formative scale. So again, I will start with there are two types of measurement. Any health measurement which we are doing, we generally try to identify the type of measurement which we do. The first type of measurement is the reflective. In the reflective, we have learned that the construct is there already. And what is a construct? So, generally, construct we call latent variable or latent something hidden, which we cannot measure directly, like depression or like anxiety or like self efficacy or like health belief, all those psychological construct or which is there in our psychological domain. So there are ways to identify it, and we have discussed that something which is there even without the items. That means if I am suffering from depression, even if somebody has not designed the big depression inventory, I will have the depression. But in case of a formative scale, what happens that there are indicators, and if you don't merge those indicators or item, then that new item or the construct which you have formed, like socio-demographic scale, that is not going to be possible because that is the aggregation of those individual items. So this error term, we will try to again explain this error term today. I'll start the session with this because this is the basis of overall, whenever you do the uh, exploratory factor analysis or principal component analysis or the CFA, confirmatory factor analysis, you need to understand this error. So reflective scales, we know that the construct is there already in the psychological domain of the person or the respondent, and we are trying to measure it through items. So basically, it says that if my level of depression is high, I will score high on the item, right? So the construct, it affects the item, and the direction of arrow is from the construct towards the item. And if there is a change in construct, that means if there is a change in level of depression, the items will be affected. And that's what we did yesterday, that the independent variable in this case is the construct, which is also known as factor. Many times we call it as a factor. And the variable is also known as the item. There are various variables. So this change in the construct leads to change in the item response. That was reflective. Do you all agree with this? We discussed this yesterday. So we have learned that the error term, if you can recall, that error term was there with each item. And we have discussed why, because that a particular item, it may be the reflection of some other construct. Like we have discussed yesterday regarding the job satisfaction, where there was like, I feel comfortable at workplace. So my own anxiety level and my own mental health, which is my domain, can also affect this item. So that's why each item has got a unique error term, which is error at each item level, but this factor is common to all. And that's why the error term, it represents it may be, we discussed, it may be a systematic error or random error. Random error, we know it may be a random noise, or it may be a measurement error, or it may be a error which is unrelated to a particular construct. Suppose let's explain this with three items. So, and if the anxiety is my underlying construct, and I am measuring the anxiety with these three items. So, first item is I feel nervous in stressful condition. This is my first item. The second item is I worry excessively about future event. And my third item is I find it hard to relax during the day. Okay. So now what can, if my three items are this, what can be the individual error in this? So I feel nervous in stressful situation. So first you see the first one, which is the stressful situation. So if I use this word stressful, this will be interpreted differently by the different individual, because the stress is, it's a very subjective term, and it might vary from one person to another person. The second item is like I worry excessively about future event. Now again, I don't know how future means. This future is again not, cannot be defined for everyone very realistically, because it is not necessary that everyone will think so much about the future. There are people who don't think much about the future and they remain in present, and there are people who always think about the future. So this variance will be too much in this case if you have such words in your item. The third thing can be during the day. So this question is I find it hard to relax during the day. If you ask this question during the day, then again this is there can be a random differences in the relaxation level. There can be a person in routine ways he doesn't relax during the daytime, but it is not due to the anxiety, it may be due to some other factor. So again, these error, you can see each item is having a unique error term. But if you, so in case of a reflective scale, the error so you can see that if you think that our brain is like a house where you have to go and peep, so these items are like window through which you can peep the psychological domain, or you can just see the psychological space through that window. But if the window is foggy, or if the window is like glass of the window is not very clear, then the construct, or the construct which you are measuring, that may not be clearly visible. Although it is said that there will always be a measurement error, it will never be accurate. The true score of the construct you cannot measure. There will be error. Either it is a reflective scale or it is a formative scale. Any measurement cannot be error free. It will never be as true value. There will be a error term. But in case of a item of a reflective scale, if these errors are there, then again it will affect the true measurement of the construct. Coming to formative scale. So how we have determined the formative scale? In case of a formative scale, that construct we are forming. That's why the term is formative. That means it is not like, if you see Human Development Index, it is not there in our psychological domain. Rather, somebody has created it, and then when you listen it many times, then it goes into your brain. So formative scale, it's the formation by the individual, by some scientist or by some person, and it is you identify or formed it through items so that you can compare, maybe the country wise comparison, or maybe just to see the status of the various country. Let's say I'm just giving example of that Human Development Index. So that's why they are known as the formative scale, because they have been formed by the person by using few indicators and aggregating them. So items, they collectively define the construct. They are not caused by this. And one major difference is if you drop one item from formative scale, then your measurement is not complete. But in case of a reflective scale, like yesterday we were discussing that even if some item is not performing good or its correlation is less, then you can definitely drop that item from your scale. Still, the other items will measure your reflective construct. So formative, in case of a formative scale, the the error is there at the construct level. Why it is there at the construct level? Because let's say socio-demographic variable or Kupu-Swami scale. So you have taken three indicators: education, occupation, and income. But there may be some other item or some other indicator also which is useful for assessing the socioeconomic status. Maybe in the future time there can be some addition of indicator also in case of a socioeconomic status. And we have defined, but currently it is having only three indicator, that is the occupation, income, and education. So the error term is there at the construct level because there can be some other item also, or some other uh, item which can also lead add to the accurate measurement of the construct, which is the formative construct. So in case of a error term, this factor, or factor, what is factor? Factor, I said that the construct we also call it as a factor. So there can be some error which we are not capturing through all those three indicators. That's why error term is there at the level of construct. For example, if there are these are the four items. What are these four items? Frequency of blood glucose monitoring, adherence to medication, physical activity level, and diet control. If I have taken these four indicators to form a formative scale, which is the diabetes management, then you can see these four are forming these four indicators or the items. They are forming the diabetes. The direction of arrow is from these items to the formative construct. And if you see the error term, it is there at the level of construct. Why? There can be some other factor like stress or like access to healthcare, or maybe some other hidden factors also, the family support or the social support, which we have not measured. So again, the social support and the family support, it is also needed to say that yes, there was a diabetes, whether it was managed in a good way or in a bad way. So the error term is there at the level of construct. Why? Because some other item can also be added to reduce this error. So that's why we always say that some unexplained error is there, which says that we are not measuring the true value of the diabetes management. Okay, so that's why in case of a formative scale, the by only measuring the few ingredients in like exercise and medication, the your construct, formative construct, that is not complete, means there will be some error. So if again I because in any of this scale development or validation, the most important concept for you people is to identify the type of measurement. Once you identify it, then it will be very clear that what all reliability and validity studies you have to do, because you cannot perform all the type of reliability in case of a reflective scale or in case of a formative scale. There are clear cut discretion or the differentiation between the type of validity and reliability which you do in case of a reflective scale and which you do if the case is a formative scale. So that's why you should always ask these 3 or 4 questions from yourself whenever you are trying to do a validity studies. The first one, whatever construct or whatever indicator I am developing, is it there already? Already means where? In the psychological domain of the human being or from the respondent. If it is already there and you have to measure, then it is a reflective scale. If it is not already there and you are constructing it by taking few indicators, then it is a formative. This is the first question. So if the latent construct exists independent of the measure used, then it is a reflective model. If the latent construct is determined as a combination of its indicator, it is a formative model. First question. Second question you should ask, rather you will say that if you have defined the first one, the nature of construct, of course you will have items which will be a reflection of the those underlying constructs. So direction of causality or the error, if in the arrow you see, so it will be from construct to items, because construct is going to affect the items and variation in the construct will cause the variation in the item measure. And in case of a formative model, the causality means the direction of arrow. arrow, it will be from items to the construct. And the variation, if there is a variation in the construct, that means that if there are variation in the items, that will cause the variation in the construct. It will not be the other way around. And then what is the characteristics of item use? So we have discussed this yesterday also, that items are manifested by the construct. And if you add or drop an item in case of a reflective scale, the domain or the psychological domain is not going to change. But in case of a formative model, if you add or drop any item, then it may change. So that's the basic difference between a reflective and formative. And why this matters? Because we have discussed that validity and reliability studies are relatively different if you are validating a reflective scale or if you are validating a formative scale. So that's why the difference of these two, reflective versus formative, it is essential. So I hope like participants, which like few participants, they came out yesterday also regarding their measurement, and then you should be clear enough, because in this workshop primarily we are focusing on reflective scales. But yes, of course, simultaneously we will be telling you where you can use this. I mean, which all statistical technique which you should use for formative scales. So yes, we will cover formative also simultaneously, but majority of the but we are not going to cover the workshop like if first we will tell reflective and then we will tell formative. No, we are not going to do like that. We will be telling you the validation techniques, both reliability and the validity studies. And simultaneously with each technique, we are going to tell like which technique you can do in case of a reflective scale and which you cannot do for formative and which are essential for formative. So we will be telling that simultaneously. So it is requested from all of you, like you please listen carefully and then catch the point which are of your use. I mean, like people who are working on formative scale, you can try noting down, or maybe the videos will be available to you. So what all you can do with the formative scales, because I think one NC is developing some reflective scale, and I think Ashwati or once I forgot the name yesterday, she was telling me that yesterday regarding that medical officers or some community health officers competency. So you that competency, what she told and what Dr. Ravi gave the input. So it is a formative scale. So you can pick the relevant content for your use. Otherwise, like generic, we majority of the content will be on reflective scale. So I think we may start where we left yesterday. So we have stopped at this level, variance. So we discussed up till this point where, so we will start with the concept of variance. Now, variance as the term you have seen, many of you have heard this term and many of you have not heard. Never mind. We are going to explain, we will try to explain it in very simple language so that you people can understand. So this is just a simple example. You can see what you can see here, that there are individual and there's a score of a daily mood rating. So daily mood rating score, I have to score it from 0 to from 1 can understand. So this is just a simple example. You can see what you can see here, that there are individual and there's a score of a daily mood rating. So daily mood rating score, I have to score it from 0 to from 1 to 10. And
നാണോ മുറിക്കുന്നുണ്ടോ ചോദിച്ചു
you can mute. So can note down the time. So on Monday the total rating of this mood is 6. On Tuesday it is 8. On Wednesday it is 4. Then again Thursday it is 7. Friday 5, Saturday it is 9, and then again Friday it is 5. So probably if like I'm using, there is some scale and which I'm using to rate my daily mood. So this was the overall every day's rating. So if I ask this question, is there a variation in individual mood across different days over week? What is your answer? Yes or no? So Ashwati is saying yes. Yes. So there, of course, you can see that there is a variance, means it is varying. What is the literal meaning of variance? Basically, it is the something which, it keeps on varying. So variance, if there is a variance in this daily mood, and if I have to calculate how much there is a difference from the mean. So how I calculate the mean? I will just add up all these scores, divide it by total number of days, which is 7, and then the total score is 6.29. Mean, I mean, it's the mean. So if I have to see how much, so variance, how do you calculate? So basically, you see from mean, how much is the distance from the mean? So if the mean is 6.29, what is the difference of this my mood from the mean level each day? So you will see that on Monday, it will be like I will just minus this mean from each day. So Monday it was 6. So the difference is minus 0.29. On Tuesday it is 8 minus 6.29. So it will be plus 1.71. Similarly, you can see I have got these difference from mean at each day, right? So now if you calculate, if you just add all these differences, you will see that it will come to 0. So that's why this is just the mean deviation. But we want to know the variance. So how do we calculate statistically? What do? We just square it. Why there is a 0? Because the negative and positive, it cancels like each other. So that's why you will find a value of 0. So that's why in statistics, in bar statistics, this variance term is very important. Because see, whenever you measure something, there is a variation from one person to another person. But we have to take care of this variance statistically. Otherwise, our measurement will not be accurate. So that's why in any wherever you will apply statistical technique, there will be some underlying concept of variance. So this is just variance, which we are the basic concept of variance is you just the mean value, you take the difference of mean from the individual value and you square it. So if you square it, and this is just that same hai, although the mood rating vary from day to day, but the sum of difference from mean adds up to 0. Why? Because there are few positive and few negative. So that's why what generally it is recommended that variance is defined as square of this difference. So if you square and if you add it, this will be your variance. So the total variance sum of square. So that's why it is also known as SSS, sum of square. So this is the sum of square and this is also known as the variance. So if this is the variance, then it shows that how much the individual data points differ from mean of in the data set. So this we understand by variance. Okay, so whenever you hear this term variance, just imagine that it will be like difference of the mean value and the individual value, and it's the square of that. So now if you have this mood rating of one person from Monday to Sunday, so can you tell that what is the variance of mood in case of this table? What will be the variance? Yes? Okay, so Ashwati is writing 0. Ravi is writing none. Bushra 0. Okay, rightly said. So since there is no variation, every date is fixed. So that's why the sum of square will be 0 and the variance will be 0. So we will talk about variance in case of when we will discuss the reliability also. But right now, this was the variance which we wanted to introduce the concept of variance. Now coming to these steps. So this we have till now what we have discussed. We have discussed the various types of variable, like there is a latent construct and there is a theoretical versus a theoretical construct. We have discussed the reflective versus formative model. We have discussed what is the difference between the two. We have also discussed what is an error, what is a measurement error, what is a random error, what is a systematic error, and why we are doing this reliability and validity studies. Because we want our scale to be of minimum of error. We don't want our scale to be full of error, so that when then the measurement will not be accurate. So that's why there needs to be reliability and validity studies, and we need to validate any scale, because ultimately what we remember that these items or scale are the window of your psychological domain, and through that you can see the psychological space of the person, not see visually, rather you can measure it. So now coming to the actual steps of scale development, or if you are starting afresh, means I think NC is developing a scale where she is generating the items also. So yes, for PhD thesis or for a big project, there are people who are developing a scratch from new, but it is not always true for many of us. Like many of us, what we do, if there is already a scale which is existing, we try to use that scale, of course, after the permission, because many of these scales are a paid scales. And if you don't want to pay and if you want to modify it, then again you need a written permission from the competent authority, means the person who has formulated that scale. So if it is there, and if it is there in as a free, that is under the common creative license, you can use it. But again, you have to intimate to the person that you are using their scale. If it is not possible, then you have to, if there's no scale or your construct is entirely new, then you may think of developing a scale. But development of a scale entirely from scratch, it is a time taking and a resource intensive process. So again, approximately 1.5 to 2 years spent on this development of a scale. So if first is what if you see the standard book like Norman or Robert or many articles, they always say that any construct, generally they say that if there is a construct, it has been defined in the past, and there will be a scale existing. Generally, construct means I'm talking of a reflective one. There will be a scale which is existing. Why? May not be in health, but maybe in marketing, maybe in social science, maybe in anthropology, maybe in psychology, or maybe in education. Many medical education tool, they are like they have been initially taken from the general education, so that is important. So you have to think like, is there any need of development of a new scale? Because if already work has been done, then you can take, take that particular scale and you can modify it in your context. And then if it is not there, then you can think for a new scale development. So the first step, what is the first step? First is identify the construct of interest. So, like in case of NC or in case of Ashwati, if you are developing a scale from scratch, then you have to, whether it is a formative scale or whether it is a reflective scale, you have to identify for the construct of interest, construct of interest, like competency of medical officers, which we were discussing yesterday, the care competency of the care level, or maybe if you are doing something medical education, then you can define a construct like competency of medical teachers. So if that is the scale, then you have to identify first the construct which you are going to measure. Then the second step, you have to first search for a validated questionnaire already in the literature. So literature search is important. You should do thorough literature search, and maybe in this case, what we recommend that don't put that last 5 years or last 10 years, because you will see that many of these work, it has been done long back during the 1990s and 2000. So if you put a cap of like these years, last 5 years, you may not get a validated scale. And try to see the scale which has been developed outside India. Means I'm not criticizing people from India, but generally if you see the methodology, uh, we are not that rigorous. That research rigor is not that much. Uh, here. Maybe there are a lot of other factors also, because we don't have support also. There is a issue of funding also. Research here in India, it's not always funded, and if there is a funding, there are issue of skills, and a lot of other factors are also there. But if you see a good paper and it has a good impact factor, then try to see that validated questionnaire which is there in the literature. So it is requested from all of you, since you have joined this workshop, maybe you will have something in your mind. So can you all please write any construct here in in uh, in the chat box. So Ravi is saying scale to measure anxiety. Ashwati is saying we have to many times start from the scratch. Yes, Ashwati, I can understand. You are right. We are working on the functional digestive capacity and no much published study, but we find literature in that text. Okay, good. Then you are starting from scratch. Divya is writing pain score. Yes. Medication adherence for diabetes. Akash is writing. Okay.
Out of box.
Any other idea which you can think of? Like Ashwati is working on functional digestive capacity. Functional digestive capacity of what, like Ashwati? Can you please make it more clear?
Yes, like in I told I'm from Ayurveda background, so we have a pattern of digestion that's seen in individuals. So this is described in our text. We have mainly four pattern of digestion. So we are eliciting these pattern in normal individuals. So
Okay.
we have lot of not much literature, because in
Okay.
Ayurveda text we have information in abstract form.
Okay. Agree. Agree.
If you see it, it's in verses. So they have given a set of symptoms. From those set of symptoms, we have to elicit the scenarios in daily life, like what they encounter.
Okay, okay. Thank you. Can you show the chat? Yes. So we can see like participants have written, Divya has written, Ansi has written, shed scale to measure emotional intelligence, medication adherence for diabetes. Akash has written, Mayuri has written environmental assessment. Chetanjeet, Maria has also written adherence to rehabilitation. Ekta has written
Adherence.
scale to measure nutritional well-being. Self-esteem, like Rosenberg,
Self-esteem.
self-esteem, Sai has written, Renuka is assessing lifestyle for cancer. Physician attitude for referral in India. Dr. Maria has written
Necessary.
that. Yes, physician attitude for referral. That is also a good topic, and very, I think it is an operational sort of research. Munisha is writing scale to measure the learning style, learning good. And then Bhavna has written menstrual health. So yes, you can see like all of you have some construct in your mind, which you either you want to measure that, or if it is there is no existing literature which is there, then you have to develop it from scratch. So that can be there. So the next activity is, generally it is said that generally every construct which is available, it is already there. Unless it is entirely a new one, like which Ashwati was saying, the digestive capacity, then in that case, yes, she will have to like put everything from scratch, start everything from scratch, because that vague description is there in the literature, but that clear cut definition is not there. So in that case, you have to first define what is the digestive capacity for your example. In others case, maybe something you will get from the literature like physician attitude of referral. In that case, you may get some other attitude scale, and which you can modify. I don't know, maybe Dr. Maria, you must have done some literature review. So I don't know if you have got something or you have to start from scratch. So again, it depends the type of topic which you have. So generally, we will get something. Something means some attitude scale you will get. But again, seeing those, you can take help and then you can develop your own scale. So then that's why if first I will tell you that if there is already there is an existing scale, like somebody has written SHAT scale or somebody has written emotional intelligence scale. So there are scales which are already there, and if you get a permission to use that scale, you need to modify it. Yesterday also, few participants they texted in the chat box that do we need to modify a scale or validate a scale if it has been developed outside country? So answer is yes. I guess in the I mean, you have to see each and every item in your context because the participants from your country are entirely different from the participants of the European and Western country. So the first I will tell you a very simple process, that is the translation. So translation is like if it is there in English, so you have to translate because generally translation is required for the scale development process in the regional language or the local language. Because if there is a level of literacy, it is good that you give it as a in the form of a self-administered scale. But if the literacy is not that good, then there are ways to handle that. You can take the interview, or also there are ways where even if the person is illiterate, they can attempt those questions. So we'll discuss this part later. First, I'll discuss this translation. So this translation is again, it is a very important, although it is always people, they generally they write it in their manuscript that they have done the forward and backward translation, but generally not always it's done the way it should be done. So if a validated measure of scale, if a validated scale is there in your construct, and you got a permission to use that, then you have to you know do a translation. So translation first is you have to do it in your native language, and then again you have to do the other back translation, because after that only you will do a validation study. So translation of a scale, it is again a iterative process. Means it is what do I mean by iterative? It is not done in a single step. You do a translation, you discuss it, again you go and you have a second a translated version, you have a third translated version. So in few 3, 4, 5 steps, you get a final translated version of the scale. So for this, the first is to establish expert committee. Now, this is always said expert committee, but if you go and try to find out expert committee, this is a difficult task because generally experts are there all over India. But in this case, if anybody agrees to be expert of your this translation process, then this is good. Otherwise, what generally you can do, you can have one language expert in your team. One, you are there as a researcher, and then you can ask someone who is a knowledgeable person of your topic also, and who has got hold of both the languages, Hindi and English in case of Bihar. But like if you are from Maharashtra, that Marathi and English, or from Tamil Nadu, or from Telugu, or all those language, Bengali, it is there. So you have to have a person who is expert, which we call as a language expert, in your team. That you should try to have that. And then again, you and the second person should be subject expert. So what do I mean by subject expert? That person should be working on that particular topic. So then if you ask from me regarding the number of expert, even if there are two people, one expert, subject expert, and one language expert, two people means you have to make two group. Why I'm saying two group? Because you have to make a back translation activity also. So yes, Dr. Maria has asked the same question, minimum number of experts required. So if you say like minimum number, again, it is a feasibility. You can say like 2 to 3. This is the minimum. So two, even like, uh, it depends on the resource also. If it is a funded and if you can pay, then definitely you can have 3, 4. But generally we do projects like in the form of a thesis or in the form of some fellowship. In that case, yes, of course, at least you should have two team means two people who will do a forward translation, one team, and the other team will do a backward translation. So at least two people, one language expert and one a subject expert. And then there can be like you are also there, you will moderate this. So two-person you can minimum number, if we have I can't say any reference, but practically what we have seen, that there is a problem in getting those people. So even if there are two people who are actually working, because many times you will see that there are people in your group but they are not working. So we don't want, many times you will see that people put the name as such only for the name's sake, that if this person will be there as an expert, whatever I will do, and then they put that stamp, okay, whatever you have done, that is okay. But we don't want such input, that only for the name's sake you are putting a name of the person, and then you are doing everything on your own, and that person has only validated whatever you have done. So that's the kind of activity which generally we see here. Like everything is done by the students, and when the teacher say yes, everything is okay. But no, that active input is required, and I guess a person who can actively be engaged in your project, either out of interest or either out of some other incentives, then definitely he should be there. So one person as a language expert and one subject expert and one you. So three of you can do this forward translation, and another a person, another group can be for the backward translation. Means like you have, if you have done from English to Marathi, then the other set of people will do from Marathi to English, and then you can have you can match these two again. You all can sit together and see for any consistent inconsistency, and you can try to remove those inconsistencies. But again, like I said, because we also do PG thesis as a part of the MD thesis, so many of our students, and even there was a project of ICMR on developing a scale which was a nomophobia. Nomophobia is a no mobile phobia, which is there in the medical students. If they don't see the mobile, not there, it is not there only in medical students, that is there like across the every age, you can say. So it was primarily the psychiatry department was there as a principal investigator, and few of us were like there from Dr. Shamshad was there as a co-PI. So we have seen that process, and there also we have seen that it was difficult to get the experts. So few of us acted like few from the psychiatry, few from the community medicine, and there was one person here at AIMS who was a language expert. So then they consulted them. So probably yes, of course, two you can say like two group of two people at least minimum, that much is required. And Dr. Maria is saying IEC says 5. Again, Dr. Maria, you can put the name as such, because what we have seen, that name is there. Even if you see ICMR projects, there will be a lot of other people are also there, but uh, 5, I can't say, because 5 we have faced difficulty in getting 5 people. But yes, what you can do this. There is a solution of this problem. Initial translation, you can get it done by the 2 people, and then the other you can get it approved by rest of the 3 people. But you are said for questionnaire validation, but we are discussing only the translation part. So are you saying the for translation, or are you saying the questionnaire? Because validation is a very long process, which have the content validation, which has the construct validation, it has got the reliability. So I'm not sure what do you mean by this questionnaire validation, because right now the number of experts which we are saying, that is only for the translation activity. Am I making myself clear?
Yeah, got it, ma'am. Very clear. Yeah.
Okay.
So
So
for questionnaire validation, also they said 5, and for translation also they said we need 5. So 5 minimal experts are needed. That's what the IEC put us. So I understand your viewpoint of taking 2 groups, and even if you're taking 3, one as a moderator, two, that makes 5. So I think that's a very soluble thing to go through.
yeah. So we have done this like 2 people again, because 2 is needed. 2 for forward, 2 for backward, and 1 you as a researcher. So maybe that 5 then that criteria gets satisfied probably. So or else you can, I mean, you can work it out if they say, but actually the 2 plus 2, I think that works well in our case. That worked well in our case. So now let's see the translation activity. So this was one, I think we have given this activity. Have we shared?
वो शेयर कर दिया और PDF उनको डे 1 में PDF भी है
Okay.
लेकिन इसको देखो
Okay. So this is like one question. When a friend starts to talk about his or her problem, I try to steer the conversation towards something else. And the second is when I see someone being taken advantage of, I feel kind of protective towards him or her. These are the two items which I have taken from the Toronto empathy scale. So, first, I think should I go for the translation activity now? No? So, I'll go to the day 1 है तो मैं उसके प्रति सुरक्षात्मक महसूस करता हूँ. So this was group B. If you see, we have divided that in group A and group B. So this was the translation activity of group B. Then the next, if you see the other language, yes, Hindi was only, I think, single.
Group B में कौन है?
Just a sec. I'm not able to find my mouse. Yeah, it is there now. No, Hindi is again, Dr. Joseph has done it. जब मैं किसी का फायदा उठाते हुए देखता हूं तो मैं उसके प्रति सुरक्षात्मक महसूस करता हूं. I think these two are same. If you see, this Dr. Ravi, if I take these two as a language expert, maybe two people, then I think जब मैं किसी को देखता हूँ किसी का फायदा उठाया जा रहा है तो मैं उसके प्रति सुरक्षात्मक महसूस करता हूँ. एंड हियर ही हैज रिटन जब मैं किसी का फायदा उठाते देखता हूँ तो मैं उसके प्रति सुरक्षात्मक. सो दिस इज काइंड ऑफ ऑलमोस्ट द सेम which we can see the kind of this thing, the translation. Now coming to group A, this is the group A, and if you see, okay, again this is group, no, but this is just group A. I have to go to response, then view in sheet, and then if I see, yes, so here we can see more number of Hindis like Prerna, Bhavna, Ravi, Yachna. जब मैं कभी मेरे मित्र अपनी समस्याओं के बारे में वार्ता करने लगते हैं तब मैं वार्तालाप का विषय बदल देती हूँ. सो यू कैन सी हियर लाइक इफ यू सी दिस ट्रांसलेशन लाइक वार्ता and vartalap. So I don't know how much we use these words because generally we call like baat or baatcheet, but again it depends in your context. That's why the language expert of your area, because Hindi has also a lot of dialects. So what your respondent or the people on whom you are going to put that scale, again you will do a pre-testing. But till now, if you are finalizing the language part, you need to be very careful regarding these words like varta and vartalap and Vishay also. Like Vishay, I don't know how much of us will talk about this Vishay. अगेन लाइक भावना है रिटन जब कोई दोस्त अपनी समस्याओं के बारे में बात करना शुरू करता है तो मैं बातचीत को किसी और चीज की ओर ले जाने की कोशिश करता हूँ. अगेन लाइक चीज, इफ यू सी दिस टर्म लाइक चीज, किसी और चीज, सो दिस इज नॉट वेरी क्लियर. अगेन इट इज रिटन लाइक जब कोई मित्र ये दिस इज द सेम रवि हैज रिटन इन ग्रुप, आई थिंक बोथ द ग्रुप. And yes, some few people have written dost, one person has written mitra. याचना has written जब भी मेरा दोस्त मुझे अपने परेशानी के बारे में बात करना. So you can see now there are two terms. One person has written परेशानी, one person has written समस्या. So you have to see like discuss from the expert and language people which will be the right word, whether it is परेशानी or whether it is समस्या. Again, these things will come up after discussion, what you should keep and what other people, generally what they talk. Do they tell like as a problem as a samasya, or do they say this word as a pareshani? And then here she has written like मैं किसी दूसरे और इशारा कर देता हूँ. So this इशारा and then मोड़ना. So you can see the difference in the translation. So this translation activity, it seems that it is very simple. But when you start doing it, because if this activity has not been done the way it has been suggested, then there will be some measurement error. Means when you will give this to a person who has to fill it in as a self administered questionnaire, then we have just shown you the error. People might understand it differently. Again, if I come down, Ekta has also written जब कोई दोस्त. So now she has written दोस्त अपनी समस्याओं के बारे में बात शुरू करता है तो मैं बातचीत को किसी और चीज की ओर ले जाने की कोशिश करती हूँ. Then again, if you see, Maria has also written in Hindi and Jyoti. So जब कोई मित्र अपनी समस्याओं के बारे में बात करना शुरू करता है तो मैं बातचीत को किसी और चीज की ओर ले जाने का प्रयास करता हूँ. This is again very much similar to what Ravi and other people have done, and this is, I think, both are same. Jyoti has written like मैं बातचीत को किसी और दिशा में मोड़ने. So again you can see the difference between किसी और ले जाने का और मोड़ने का प्रयास. So I am not saying like which is wrong or which is right. So this is just a way, because what type of Hindi people speak in your area. And again, with this Hindi, you also you do what we call it as a cognitive interview. Means you talk to the patient, not patient per se, respondent, on whom you have to administer the scale, and you ask from them also. Like, do they find some difficulty in understanding the stem of this item, or do they suggest something else? But again, for now, this forward translation, this activity you all have done, and then again, you have to do the back translation also, and I think you have done it. So I will just compare the initial stem with the final one, the back translation. So if I go here in the back translation activity, so back translation, if you see the group A, this is the only. So group A has to do the back translation of when a friend starts to talk about his or her problem, I try to steer the conversation towards something else. So if you see the backward translation, these were the backward translations. So you can see the difference. When my friend shares his problem with me, I divert the discussion to something else. Okay. So this was the initial English. I try to steer the conversation. But again, steer word, if you see, what will this steer word and divert word, is it the same or not? So then you have to, again, this is a matter of discussion. When a friend starts to talk to me about his problem, then I try to steer. So this is almost, I think, the same, the previous one. When any friend starts talking about their problem, I try to take a conversation to some other thing, because किसी और चीज था. So you have to see like towards something else. Here it is something else. Here it was some other thing. So I think you have to discuss like whether these two terms are same or not. Whenever my friends. Now here he has written whenever my friends. And initially it was when a friend. So you need to see like, is it talking about single person or is it talking about many friends? So initially, like generally people have used in singular, but here I think someone has used it like my friends. Then again, it is writing of when a friend when talks about his troubles. So now he has written a term trouble. So you have to see whether this trouble and problem are they same or not. Like it is generally how the people take their words whenever they see. So is the trouble and problem same? So problem maybe sometimes it is said that it is due to destiny, those problems, and trouble is like given by some person. So I'm not saying that this is true. Maybe this is how I perceive. Again, you have to ask from the respondents in the p-testing. Right now, we are discussing it with the language expert. So you can just see the differences in the back translation also. Again, you can see whenever my friends start to share. Now, here the term there is a share. So there is a difference between talk, share. Again, most of the people have like written talk. But again, here you can say someone has written sharing. Tries to talk, telling, discuss her. Someone has written discuss her problem. Generally, they have written talk or speak. One person has written speak about his difficulty. So what is the difference between speak? Because here the difference between talk and speak. So you might find it like I'm going dissecting too much, but no, that is needed, because whenever you do the back translation and forward translation, these dissections are needed. Why? Because then ultimately it will go to the respondent, and everyone should understand similarly with the stem of your item. So this is the kind of thing. Coming to the group B, if I go to group B, uh, I think second question, not much people, many people have done it. Group B, when I see someone being taken advantage of, I feel kind of protective. And here they have written like when I see anyone. So there is a difference. This here it is anyone, and here it is someone. Again, being subjugated. I become protective towards that person. Whenever I see someone being exploited, again by others, I feel defensive. So you just have to see the back translation. It should be very much similar, even if it is some other word is there as the original word. From the original word, the meaning should convey, it should be the same meaning. So that is the you know work of the language expert. He will tell you, he or she will tell you regarding the difference in the meaning, which may be understood or which may be interpreted by the subjects when they will see these terms. So that's the general way you should go for the forward and backward translation. So and of course, if it is in some other language, the same process will be repeated, whether it is in Telugu or whether it is in so other language. You people can see, I think we will share this with you, and you can see, those of you who have done it in Telugu or those of you who have done it in Bengali, you can just see what is the difference. Now coming to the, if you see the, so this was regarding the forward and backward translation activity. So once you have done the forward and backward translation, then here it is written pilot testing. But before you do the pilot testing, you need to do the pre-testing. We have discussed this term later. And we have also discussed what is the difference between pre-testing and pilot testing. So pre-testing is what, like I was saying, once you have finalized. Again, this pre-testing is applicable. I have not come to the people who are planning to develop a scale from scratch, because then I have not talked about item generation. So we are just saying that if already scale is there and you have just translated it, you will pre-test it with few of the study subjects. Again, asking from them regarding the language, regarding the interpretation, regarding the clarity, and then you can also go for the reliability and validity once you get these many samples. So then you do the pilot testing. So what is a pilot testing? Pilot testing is like a simulation sort of thing. Whatever research you is going to do, you do it on a small number of people, let's say from 30 to 50. And then what is the purpose of that? Basically, you determine the reliability of your questionnaire before sending it to everyone. Like let's say if your sample size is 200 or 300, you don't want a less validated questionnaire to go to the people who are ultimately going to fill it. So before that, you want to get responses from 30 to 50 individual and check the internal consistency. We will talk about the internal consistency in the second part of the day. That is the reliability. So this is regarding the pilot testing. So Dr. Renuka is saying, ma'am, pre-testing is what we do in cognitive validation. Yes, generally pre-testing, cognitive validate means pre-testing. There again, there are 3-4 stakeholders in pre-testing. You call some other experts also, you talk to them if it is available, of course. And then you talk to the participants, you do the cognitive interview, and then you basically try to understand the final part of the translated version of the questionnaire which you have. Like if any other ambiguity or any change, if it is required, what the participants say. But generally, it should not be done. Like what we have seen, like many times, the students, they do it on their friends. So that should not be there, because the language of their friends, means if medical students and the people who are there in the periphery means the community or the patients, it will be entirely different. So they should do this cognitive interviewing or cognitive validation from the people who are actually a representative of their sample size. I mean sample. And then why do you do that? So on this 30 to 50 individual, you are going to perform two activity. First, you will do see the content validity. Means content validity, again, you need experts. We will talk about the content validity, and you will check for the internal consistency. So this in this pilot testing, you do these two activity. We will talk about these two. And finally, after that, if my content validity index is acceptable and my internal consistency, which I will be measuring in the form of Cronbach alpha, if it is acceptable, I have the final translated version of the scale and I will go for my study. So this is the background process, and this you have to write whenever you are measuring any health related variable, whether it is an already scale is available. So this I am talking already scale is available, and I want to use that scale after taking the permission, after translating it, doing the back translation, having a finalized version, doing the pre-testing, then pilot testing. In pilot testing, I will do the content validity, measure the content validity objectively, and then I will measure the internal consistency of that my tool, and then I will go for my final. Now we have to consider another situation. Another situation like Ashwathi and few other participants, they were saying that their construct is entirely new and they have to start from the scratch. In that case, if I could not find any scale to measure the construct, but and I could find some scales, but they are very costly. I cannot afford to pay that much cost. Yes, we faced one issue. I think two of our PGs, they did some adherence measurement using Morinsky scale, which is a that scale for measuring the adherence. But when we went for publication, it was there in the public domain. We wrote to the person, but we did not get any reply from that person. So we thought that they have approved it, and that the student he has completed his thesis and he went for the publication. But once the publication, I think it was out in some this thing, then that person he has like replied that he has to pay how much? $400.
1 lakh dollar.
$1 lakh. I think some very huge amount. $1 lakh for that scale. And then of course that is a very huge amount, and that
Without
student
permission.
and without any funding, because it was a PG thesis, like all of us we do. So then he has to retract. I mean, then he withdrew his publication from the journal, saying that I cannot pay, and since I cannot use, because then they will raise this issue of copyright or this thing. So that's why many times what is there is a scale, but it is costly, you cannot pay, or if you ask from permission, you don't have a permission. In that case, yes, you have to develop a new scale. So in that case, that new scale, how to, if you have to start from scratch, then you have to develop it. So first you have to justify the need of your new measure. So of course you will write all those things in the background that they are there, but they are paid one, or maybe some copyright issue, and then you need your new measure, or maybe your construct is little different from the construct which they have identified. So in that case, if you are starting from scratch, so till now what we have done, if there is a scale and it is there under common creative license, means you can use it. Then you can do the translation, do the pre-testing, do the pilot testing, and then on pilot testing, you measure the content validity index and you measure the Cronbach alpha. If both the values are acceptable, we are going to do the hands-on on content validity and Cronbach alpha. Don't worry. I'm just covering the theoretical part. And then in that case, if you have to develop, if there is a no scale available or scale is available, but it is costly, you cannot pay, and you need to develop your own measure, then you have to start from scratch. For that, again, you have to establish expert committee. So the expert committee, there should be, it depends on the nature of construct which you have. Like in case of this construct, which like nomophobia, which I was talking, no mobile phobia. So in that case, there were few people who were from psychiatry, from community medicine, from medicine. Medicine means like physicians were there. So they were the expert, and there was a psychologist also, because any scale construction, a psychology, a psychologist is needed, because he will. In I am talking about the reflective construct now, generally, because the those formative construct, yes, you don't need a psychologist, but for reflective construct, something like phobias or something like empathy or something like maybe the anxiety or many other construct which is already there in our psychological domain, a psychologist is needed in that expert committee. So you develop, you make that expert committee. It can be a like right now, Dr. Maria was saying that their IC require 5 people. So yes, you can have, and generally 5 you have, because you have people from 3-4 departments. So generally you have these 5, one biostatistician or one community medicine person will be there as epidemiologist. You have one person from social scientist or from social science background. Why? Because they know the people. So if there is a social scientist also in your expert committee, they help you to understand the background or the contextual background of the respondents. So one social science, one psychologist, 2-3 subject experts, make it total of at least 5 if it is requirement of your IC. And then again, after developing that expert committee, you have to moderate as a researcher. So you will call the meeting. These days you can have a meeting online also, Zoom meeting. And you have to, you first as a researcher, you have to work a lot on the dimensionality of the construct. So you have to do a literature search. You have to like compile all the matter, and then you will take input from them, basically, because expert will only give their judgment. They are not going to work from scratch. So as a researcher, you have to work and you have to give them all the alternative terms also where there is ambiguity, and then together they come out to a consensus regarding the definition of construct. So they define what a construct is, and then they define about the dimensionality of the construct. What do I mean by dimensionality? So if the dimensionality can be explained, like in case of a quality of life, you know that quality of life is a broad construct, but there will be again too many subdomains. Dimensions means there will be a physical quality of life, there will be a social quality, there will be a spiritual quality of life, or all those components. So that identification of that dimension of the construct, if you can do, I mean, if you can do along, and of course you will do, how you will do extensive literature search. So like you do the searching for the systematic review, not that much, but again you need to search at least 2 to 3 database to see, and not only the database, like you have to see the psych info, because psych info is basically for psychological, that's a database. So do search the psych info if you have got the access. Otherwise, at least PubMed, do the thorough search. And if you have got access of your departmental institutional library, of course you must be having, then you go for these uh, you know psych info, definitely, because they have the psychological domain. You can search the education, and I think we have shared one book with you, the PDF copy of one book, which is Norman. And towards the end, they have also written 3, 4, I think 5, 6 uh, websites from where it's from the different domain like education, anthropology, social sciences. So on that websites also you can check specifically regarding these dimensions and regarding the dimensions of the construct. So you should check, and those literature, after that literature search, you identify that dimensionality and identify the construct, and then you come to the other steps. So I'll go step by step. So first is the step is the establishment of an expert committee. So like I said that minimum composition of the committee should have like subject matter expert at least 2 to 3. Like I said, in nomophobia there was a person from medicine and there were people from psychiatry, one psychometrician which is a psychologist, that he should be there, one methodologist, methodology means epidemiologist, one statistician, one linguistic language. If you have not taken that, if, applicable sense means if you have already done the translation activity, then that is not needed. And again, end user representative. So in that committee, 1 to 2 people who are from the from the community or from the patient side, they should also be there. And then again, the researcher may take any of these roles. Like if the researcher has a skill in statistics and psychometrics, then he himself can act as any of these experts. Second is again regarding the defining of dimensionality. So we have to define the construct and identify dimensionality. So in the construct, there are two terms. Whenever we define construct, there is a conceptualization and there is a operationalization. So remember yesterday we were talking about the variable. So any construct, if you operationalize it, it becomes variable. So conceptual clarity is very much needed, and then you define how you are going to measure that. So what is conceptualization? So generally, like if I say prejudice, so prejudice, whenever you hear this term prejudice, you have got certain image in your mind whenever you see this word. So this is a general prejudice. But again, if you dissect it further, if someone says bad things about the racial group, so you will define it as a racial prejudice. If a woman earn less than men or get less salary than men for the same job, you will call that as a gender prejudice. If the doctor believe that the nursing staff, they are inferior to the doctor, then it is a professional prejudice. So you can see here that there are further dimensions of this prejudice. So a prejudice is a broad term. And then if you start defining your prejudice, so then again that dimension you have to define where you are, whether you are working on professional prejudice or gender prejudice or racial prejudice or any other. So if you answer these questions, but if you want to measure overall prejudice, then again, then also you need to define these subdomains or the dimensionality, which Dr. Ansi was talking yesterday, that you can reach to this through qualitative methods also. We'll talk about that. So sometimes what happens for generating items, you first define and make questions based on this, and then you talk, you do the in-depth interview and you do the focus group interview, and then you record that interview and then make the items from what people have said. So, but again, right now I'm just defining my construct. I'm defining the dimensionality of my construct. And then again, after I have defined it, let's say I said that yes, I have got these three subdomain of this prejudice or domain of the prejudice, which is the professional prejudice, the gender prejudice, and the one is the racial prejudice. Now I need to make it operational. What do I mean by operational? In any research, we always define the operational definition of our variable. Like let's say if I say that I have to take current smokers in my research. So how do I define my current smoker? I say that the person who has been smoking from last 1 year or from last 6 months. Or if I have to decide residence, so how do I define it? The person who has been living in that area, urban or rural, from the last 1 year or last 2 year, whatever definition. So you define your variable some operationally. Similarly, here also, whenever you are defining a construct, you have to operationalize it, because those abstractions you cannot measure, so you have to make it into a concrete thing, and that is the basically through the operationalization. So what is the operationalization? So basically whenever you define a construct, you define a construct based on some theory or some operational definition, you just try to make it something from where you can measure it. So how we can measure it? So generally any construct, it cannot be measured by single variable. We were talking yesterday also, like Generally, a reflective or a formative construct is measured by more than variable. And yesterday we talked right regarding the spouse love. So spouse love can be uh, measured through the hugs, or through the self care, or through the respect. Similarly, happiness can be measured. If I'm happy, so it can be measured with the financial security, with cigarettes, with puppies, with a song or ice cream, or so on. So there are many items of this happiness. So similarly, translating our construct into operational definition, this is again a iterative process. And the item generation, which we know, that is again a process of operationalizing your construct. So measuring process, it doesn't start until and unless you operationalize your construct. So, what do I mean by operationalization? So, basically, operationalization is the process of making or identifying items or indicators for measuring the construct. Like we have seen yesterday, the measurement of socio-demographic status. There's a occupation, income, and the already. And again, you can add few more things regarding the socio-demographic status. What do you mean by that? So, this is regarding the identification of the construct and dimensionality. Now coming to the questionnaire format. So how do we do this? This identification of item. So generally I said that you perform a in-depth interview uh, of various stakeholders. How I do, like in case of a nomophobia scale, what they did, they performed the interview with the medical students. Then they performed the interview with the students who are having in the like normal non-technical colleges, from the fine arts, from arts, from the social sciences, and from the engineering section. So they took representative of all the students, because their age group was, I guess, maybe some range of the age group was there. And then they talked to the stakeholders also, then their teachers and the experts in this field. So after the in-depth interview of these people, they have finalized with the STEM means the item generation process. So item generation process, again, we will discuss the item generation process once more during the today's session, but this is done through the qualitative research. Now, after you have generated the item, you will come with this questionnaire format. So what is this questionnaire format? So format is like how you are going to administer it. Will it be a self-administered, or you are going to take the interview? So it depends, the decision to take whether it is a self-administered or interview-based. It depends on the nature of the respondent which you have, because it is a very critical step and that affects the reliability and validity of the data collected. So if it is a self-administered questionnaire, if something is very sensitive, if the nature of construct is sensitive, like mental health, then of course you will go for a self-administered. But if you are measuring health literacy, where you need to make people understand, then of course the interview based questionnaire will be a better option. If the people in your area are having low literacy, then you have a problem in making this as a self-administered, then you will go for a interview based. But if they are having a high literacy, then again high IQ, then you can go for a self-administered. And again, if it is a clinical setting, then you may take the interview, but if it is a very large field level survey, then you have to go with the self-administered. So, like in all workshops, we give this example that we had to do one mixed method study when there was a ban in Bihar. I think way back in 2019, 2018, probably 18-19. Just, I think 6 months back, the government decided to ban alcohol in Bihar. So after that, the government, like the State Health Society, they asked us to do a mixed method study involving 38 districts of Bihar. So it was a very huge survey asking the perception of people regarding the alcohol ban So there was a quantitative part also and there was a qualitative part also. So we conducted the qualitative interview. There was a huge team across 38. I mean, we sampled a few districts and we conducted, I guess, approximately 100 focus group discussion we conducted. And the quantitative survey, since it was again, it was not possible to do an interview. Why? It was a very large survey. So what we did, it was like there was a app by, I guess, at that time Care India was there in Bihar who supported us in that study, and there was a like something. It was named like Akasi. Akasi was like it was a self-administered. There was an app in the tab, and on that tab it was a color coded. Like it was in the form of a Likert scale, but if you say like I don't agree, then you press green. If you say I agree, then press red. So there was a various color code of those option, and it was like a audio. All the questionnaire it was like a audio recorded. So that person we used to give the tab to the person, and then he used to put the headphone on. We explained the person the purpose and regarding the questionnaire, and after hearing the questions, he or she was responding on the tab, pressing the color coded. So even if there is a literacy, but if it is a large field based survey, still you can go with the self administered questionnaire depending on the type of support you have. So that's the way you have to decide. Like Ansi was also asking yesterday. So yes, you can decide, Ansi, seeing the literacy status of your patient, seeing the feasibility, seeing the number of people, whether it should be interview based questionnaire or whether it should be a self administered questionnaire. Now coming to the response format. So in the response format again, like yes, I think and it was Nancy's question yesterday, how we will decide that whether it should be a 3-point Likert scale or a 4-point Likert scale or a 5-point Likert scale. So first we will discuss briefly about what are the different type of response format. So if you are doing something, a CAP questionnaire, knowledge attitude practice. So yes, definitely the knowledge question you asked in the form of a binary scale, yes and no questions. Clinical symptoms, whether I am having pain abdomen or not, whether I am having a weakness or not, whether I am having giddiness or not. So all these clinical questions, of course, I will answer in yes and no. So many times in your questionnaire, you will have to have the binary scales. Like, have you visited a doctor in last 12 months? So you have to answer yes and no. So it depends on the type of questions and the type of uh, the response format depends on the type of question. So binary scale, there are binary scales where the answer is yes and no. And then most commonly we use these two type of scale. In the book which we have shared to you people, that Norman and Robert, they have mentioned regarding there is a Gutman scale, there is a Thurston scale. But those scales generally, there is a semantic differential scales. But that is for academic purpose. Generally, if you see, most of the time either we use the binary response scale. In binary response, sometimes you can add a third response which is don't know or can't say. Otherwise, we use a Likert scale. So again, Likert scale, there can be, various points of Likert. It can be a 4-point, it can be a 5-point. Like generally we say it can be a odd or it can be even. So there are various pros and cons of having odd and even. If you have a odd point, like 5-point or 7-point, generally if there are people who wants to maintain neutrality, they can remain in between. If you use like a even point scale like 4-point or 6-point, then there are chances that person have to take one side. He cannot be in the middle one. So that's the pros and cons. So if you want your participants that they should not take a middle path, then you can go ahead with the even number. If there are chances that the people, you say that on that particular construct, a person might take a neutral position, then neutral stance, then you go for this odd one. Generally, you will see that most of the scales, they are in the form of an odd number. What do I mean by odd number? Either they are as a 5-point scale or a 7-point scale. in Western research, they use 9.11 point. But again, if you use that much 9 and 11, it will create ambiguity, and it will mental abstractions are not that much clear, so that the person can differentiate between no. So we recommend for Indian setup not to go beyond 7 point. 5 point is acceptable for all of us. If you want some more this thing, segregation of your responses, and you are doing something to a very literate and intellectual society, the respondents are, then you can go for a 7 point also. So coming to Likert scale, like I said, it is having, if you talk about the odd number Likert scale, then you can have like 5 point, 7 point or 11 point. So NC, did you get your answer? What should be the type of response format for your items, which you were asking yesterday? I guess you were asking. Okay. I think probably, maybe. So number of points, Ashwati is writing in response format. Can we have any type other than these two? Like these two means you want to say 5 or 7 point?
Ma'am, can you hear me?
Yeah, NC, I can hear you.
Ma'am, I got the answer, ma'am. A round off I got, but now I have to decide whether I have to go for self-administered or interview-based questionnaire. That part I have to decide because my qualitative part is done. I have done the focus group discussion. I have done the coding, everything. From the scratch, I have to develop and construct the items, ma'am, now. So now I have to decide myself whether I have to go with self-administered and which scale I have to apply for that, which type of pointed scale, binary or Likert scale I have to apply. Everything I have to decide now, ma'am. So I
Okay.
think I'll get the answer when I watch this workshop till end.
And also what you can do a pre-testing with few like 10, 15 individual using both, using self-administered and using interview. And you can see the feasibility also and the type of response which you get. And actually
Oh,
doing it will help you in understanding what you should do. Because you do it and then you decide. That's the best, because the items, the construct and the kind of people, unless and until you go and do it yourself, you will not be able to take a decision. That will help you in no, reaching this decision.
this decision, no, ma'am. First
Yeah,
interview based questionnaire. After doing interview based, we can try for self-administered,
yeah,
right, ma'am?
yeah, yeah. And then see how the response is there.
Okay, ma'am. Okay. Okay, ma'am. Thank you, ma'am. Thank you.
Okay. And Ashwati is also writing in response format. Can we have any other type than these two? Like any other type? What do you mean by
Let
this?
me explain. I'll just we are giving as I told you before, like we are giving them a daily situation. Then we ask them, how do you respond to this situation? In that case, we give them a set of list of responses that a person can act in that particular situation. In that case, no, neither binary or Likert.
Yes, it can have. It can have. Like you are saying something free listing sort of thing.
Yeah, when they attend the when like it's a digestive capacity, when they attend a party or a function, then when they have to eat a heavy meal, then how do they respond? This,
Yeah, yeah. So that in your case, it is basically, it is a different, there are distinct items,
yeah,
not
distinct items.
something reflective.
Yes, but in
Format.
that case, when we form the questionnaire in that format, then they say that these EFA and all those PCA cannot be applied in that
So
format.
it will
Again,
be
they
applied. It will
uh,
be applied. We will discuss this on the
okay,
last day. Yes, PCA, we have got a reference for
okay.
validation. You can do a PCA, which is a principal component analysis.
Okay,
You
ma'am,
can do it.
even in this case also it's a reflective model, no? It's not a categorical type, no? It's still a reflective model, right?
That we will have to see the indicators. But right now, I don't have. We
Okay,
can talk separately also.
okay,
Uh,
ma'am.
you can send us the indicator, and we may help you in deciding whether it is a reflective or it is a formative one.
Okay, ma'am. Thank
Because
you.
I need to see you have to see the items. If the items
Okay,
are distinct from each other, not related, and you are describing something which is like digestive capacity is something, it is not a psychological, rather it is a physiological thing. So
uh-huh. But it's still a construct. It's in our psychological domain, how it would be. Then we have particular domains. I'll talk to you
Okay,
later.
maybe I also need to read it since it is new
Okay.
for me. So unless and until you read it, you see in the literature, you have those indicators. Uh,
Yeah.
it is difficult right now
Yes. Yes.
exactly
Yes.
to say that.
Yes. 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 I understand, ma'am. Okay.
Okay.
Thank you. Thank you.
Dr. Renuka is asking how to choose which is optimum number of response in agreement Likert scale. See, 3 point generally, Dr. Renuka, we don't advise 3 point. Why? Because generally these ordinal scales we perform all those correlations and regression. I am apprehensive of using this word regression because I don't want our participants to get some word which they think that they don't know. But all these statistical analysis, at least 5 point scale is needed. Why? If you know the levels of measurement, the scales of measurement, there are four scales of measurement. There's a nominal, there's a ordinal, there's an interval, and there's a ratio. So generally it is said that this ordinal scale, if it is 5 point or more, you can treat them like a continuous variable. So that's why at least 5 point scale is needed. 3 point, you will not be able to perform the confirmatory factor analysis and all the other types of reliability and validity. Of course, you can perform reliability studies, but for validity studies, at least 5 point scale is needed. 7 point, yes, you can skip because I say that I'll talk just now with the 7 point. And also, your next question is also, can we have construct with single item? Generally, you don't have a construct with single item, then it'll be a simple item or a simple variable. A single item generally cannot measure a construct. At least two item also I can say that it is less, but three items or it should be more than two. Otherwise, you cannot measure a construct. It will not be a construct. It will be a simple variable like age. Age is also a construct. Gender, that is also a construct. It is having only a single item. But generally, if again you can have a validation of the responses. Like if somebody has taken gender as a categorical variable, so you can see that no, they should take it as a continuous variable. So that validity you can do, but the statistical part of validity you cannot do. The statistical validity. Yes, content validity you can do, face validity you can do, but the construct and those statistical part of validity you cannot do if you have got only single item in any construct. And then so coming to this 5 point, 7 point, and 11 point. So again, if you have 11 point scale or 7 point, even 7 point scale, then the respondents, they will get confused because ultimately whenever there is a question, you need to think about the process, the mental process which is going on. If you ask any question from me like how is my mood, or if I have to rate my mood on a scale of 1 to 10 today, or I am feeling happy, do I agree, or then I can't answer this question. If you ask this question, what is your age, I can say, see, I am these many years. If you ask like what do you do, I can say my profession. But if you ask some abstract questions like this, like rate your anxiety level or rate your mood level from 1 to 10, then I cannot answer this question immediately. I'll have to think for a while, and then I will have some, then I'll see the scales also. It is 1 to 10. How I am going to answer that? I will also have to think, should I answer 8 or should I, if I'm in a very good mood, I can say 10. If I'm in a very bad mood, I can say 1. But what about the middle one? So there are telling the difference between 8 and 9 and 7 and 8. It requires some mental processing also. I will think and then I will match that my mental thinking with the responses which I have. So it depends on the intellectual level of the person, also the thinking capacity of the person. So if you have got 7 item, then it might pose some challenges to the people because they have to think a lot. And now Ideally, we say that the points which are there, they should measure the entire continuum, leaving out no region. So you have to say that if you see the ordinal, it is increasing, but there should be equal space in between, and it should have like from lowest to the highest. Coming to the other clarity of these scale points, so I was just talking regarding the 5 point and 7 point. So if you see the 5 point, generally you have got like strongly agree, agree, neutral, disagree, or strongly agree. Strongly disagree. This is okay. But if like I increase it to like strongly, strongly agree. And then there are three terms like strongly, strongly, strongly agree. So using these terms also, it's very difficult for a respondent to answer whether he agrees strongly, strongly, or he agrees strongly, strongly, strongly. In that case, what generally you will say that we make it as a numeric scale. Like you will say that there is a numeric rating scale for pain, or this visual analog scale also 1 to 10. So generally you have to drag where do you think you agree, so they answer it in the form of a number. Like I was talking about this is a 11 point scale, and the lowest is strongly disagree, highest is strongly agree. So where do they place their level of agreement? So you can have this 9 or 11 point also, but generally you see that maximum in case of India, or you will see otherwise also 5 and 7 point generally it is uh, more acceptable. Again, in depending on the nature of construct, you can have if it is a Likert scale cap questionnaire, then you can have two type of response side format. Like for attitude or reflective form, you can have Likert scale. For awareness, you can have multiple choice or yes and no questions, or like Ashwati was saying, some other set of questions, which is entirely different from this binary or from Likert scale. And Dr. Renuka is asking, ma'am, do all construct or items should have in same type? No, it is not needed, Dr. Renuka. It depends on the construct. So, like I said, if your construct is knowledge, or if your construct is practice, then generally you have got like multiple choice or binary scale. But if your construct is a reflective, then generally you have got the items, the response format in Likert. So there can be a case where for every construct your response format will differ. It will vary. And again, depending on the respondent characteristics like their literacy level, their cognitive abilities. Like if you talk about the cognitive abilities of female here in Bihar, it is, I should not say it is poor, but it is very difficult. Whatever you ask from them, they generally say, you please ask this from my husband. I can't answer. Even for simple questions, they will say, please ask my husband. So that's the problem. You have to see the cognitive ability of the individual also who are, responding to this, and the cultural backgrounds also. And the response burden, because you know that if the length of the scale is very large and it is complex, then it might pose challenge for the respondents also, and there will be fatigue towards the end. And they will like fill out some random responses, which will have some measurement error if it is a self-administered. And regarding this, again, I said that taking response in Likert item, this one, which we were discussing, this strongly, strongly agree and disagree, it is not very easy. Many of our students, they also have done this. And when we were PG students, we also did one quality of life taking responses on this 5 point Likert scale. But it was very difficult. It was not a self-administered. It was like we used to take the interview as a student, as a PG student. So then after talking to the people, then we talk to the people. How should we talk regarding this strongly agree and agree and then neutral and then disagree, something like that. Then they said, because in life, quality of life, we ask like, how are you satisfied with your, conveyance method? How are you satisfied with your neighborhood? So that satisfaction level, then one of the person, he suggested that if you ask regarding in a rupee, like in 1 rupee, how much paisa are you satisfied? And then according to that, we used to mark the response. Like one, if the person said that I am satisfied 75 paise in 1 rupee, we used to mark 4. If he used to say that I am satisfied full 1 rupee, then we used to mark 5. So there can be some innovative ways of taking these responses, because most of the time you will see that if you ask these questions initially, they will be very confused, especially in our setting. They will say, why you are asking these questions? And then you have to explain the purpose and then tell them. So many times you will see, if the literacy level and the cognitive ability is low, then interviewing is better than self-administered. Then again, this we have discussed, the respondent characteristics, the respondent burden, the length and complexity of the scale. Coming to the how to take the decision. So if there are 10 to 20 items, that is manageable for most respondent. But if it is a huge questionnaire, and if there are complex thing in the questionnaire, then again there should be, it should be interview should be taken. The time required should not be more than 15 to 20 minutes to complete the questionnaire if it is a self-administered. Because then and how will you decide? So for that you should do the pilot testing. In that you can come to know regarding how much time, and don't do the pilot testing in your group. Do it in the actual respondents, because it they are going to tell you how much time they are taking average in filling one form. And then we have discussed this, the target population characteristics. So once you have decided, so we have discussed these 4 steps. First, you have to establish expert committee. Then you have to, in the expert committee, you should have a 2 to 3 subject expert, statistician, epidemiologist, and one, if the language expert is needed, that should be there. One psychologist should be there. The second is you have to identify the construct, you have to do the definition of that construct, and you have to come up with the operational definition. And what do I mean by operational definition? Means how you are going to measure the item, what items you will have in your construct. The third thing is questionnaire format, whether it is a self-administered or you are going to take an interview. Then it will have a response format. Are you going for a binary type, or you will have a varying type of response format for all construct? And then again, coming to the item development. So I'm coming to this item development. So Bhavna is asking, please tell pre-testing purpose. So in pre-testing, basically, you refine your questionnaire. Okay, like you have come up with the translated version, but you don't know that translated version you got this translated version from the language expert and from the person who is expert. But is that questionnaire was being understand are the respondents are able to understand that question or not? For that you need to do the pre-testing. So you again administer that question. In that you don't take the responses, you talk to the people, giving them the question, asking them the question. Like you will read out that question and you will ask from them what they have understood, or how what if they suggest any change or not. So that's the pre-testing. It is a refining of the questionnaire. Basically, you don't do any statistical calculation. You just define the your questionnaire, the language, or any ambiguities there. Like you can say that cleaning the window. Remember I said that items are the window of your brain. If the window is foggy or dirty, then the measurement which you will do of your psychological construct, that will not be accurate. You cannot see through it. So cleaning of the window is basically the purpose of the pre-testing.
Ma'am, whether we do pre-testing with experts or with actual
Both.
respondents.
I think there are 3-4 slides on pre-testing.
Okay,
So
ma'am.
when I'll come, I will explain. You need, there are 2-3 types of pre-testing. Yes, you do with the expert also.
Okay, ma'am.
Dr. Manju is saying pre-testing and pilot testing, the tool is same or not? Pilot testing is not, basically you don't do anything with the tool. Pilot testing, you do the statistical. I said that in pilot testing, it is the dress rehearsal, like convocation. All of you generally I think you must be a part of convocation, or maybe you have seen how a convocation is done. So, a day before convocation or 1 week before convocation, we do rehearsal. We walk through the stage, we wear that gown, and maybe how that announcement is done, when we have to move up, through what stairs we have to climb, through what stair we have to come down. So, basically, it is a rehearsal. So, in pre pilot testing, what is done? And before the actual start of your research, you apply this tool, which you have finalized after pre-testing, to a small sample, 30 to 50, and you see the feasibility. We have a session on pilot testing also, but you do the feasibility and you do the internal consistency, because that statistical internal consistency you do twice. You do once before you give the questionnaire, and after you get the responses also, then also you do the reliability testing. So pilot testing, basically you check with the internal consistency of the tool which you have finalized on 30 to 50 participants, and it's like a small rehearsal of your actual research, because in field many times what you have planned, that is not possible. Like I think in every workshop I give this example, that initially there was a qualitative perception of people. There was a project which we were doing, and in that initially it was planned to do the focus group discussion. We did not plan for an in-depth interview as a methodology. And it was like a perception of the beneficiary regarding the introduction of a new vaccine. But when we started taking the focus group discussion, it was difficult to carry out the focus group discussion in PHC, because it was a crowded this thing, a lot of noise. We invited 6 to 8 people, but many other people, they also they accumulated there, and everyone started talking, so it was difficult to control the crowd. So then what, later we have changed the methodology. So instead of FGD, we said that it is not feasible to do the FGD, so we took the in-depth interview. So in pilot testing, whatever methodology you have committed, many times, especially in case of a community medicine, I will say that field reality is something different. So that's why if you do it on small sample, you will come to know exactly you can do what you have committed or not, or do you need to change something before you go for a full-fledged. So that's the purpose of pilot testing. Tool is same, yes. In pre-testing, of course, after pre-testing, the tool is finalized. In pilot testing, you don't generally change the tool, but if the internal consistency is low, then again you contact your expert committee, and the again same process starts again. The process of construct, definition, dimensionality, and the item generation. Now coming to the item generation. So how do you frame a relevant item? Generally, you do the literature search and you do the in-depth interview. You may do the focus group discussion. You can do the clinical observation also. So clinical observation is it also helps what all you will have as an indicator in your construct. And then you can also go by theory. Like if you are going to develop something on a health belief model, then again you can frame items based on that theory. So Ashwati's writing, can we change the response format? Yes, you can. You are free to do any change. But the main thing is you should communicate it to the IC and your committees regarding the change in the methodology. Otherwise, you can say that you did the pilot testing and you have found that this was not possible. We also, I think one of my PG, our PG, Supriya was doing some antenatal depression on a particular scale. And she found out that on one day, which is a PMA SMA day, which is the Pradhan Mantri Surakshit Matritva Abhiyan, that is a day on 9th of every month, there is a testing of all the antenatal women. So initially she planned to do the screening on that particular day, but that particular day what she experienced, that the women were in hurry and they were not ready to give time, because they had to go to many stations for testing and all. And even if they have given the response, it was somehow it was not accurate. So then she changed her methodology, that every day she'll take and the women, so that the quality of data should be good. So that change we have communicated. So you can change anything. You can change your questionnaire, you can change your methodology, you can change the study subjects, this thing also. If you think that some other people should be included, you can communicate that now your sample, you are including some few more people or few more category of people in your research. Now, what are the tips for developing items? So this again we have taken from Robert. So you have to use short and simple sentences. We all know that. Like if you ask this question, have you ever had headache and fever? So what is the problem in this question? This one, have you had headache and fever in last 24 hours?
Headache and fever last.
Yeah. So that there are two things. So if a person is having fever, he will also say yes. If a person is having headache, he will also have yes. Okay. So at least you should ask only one piece of information at once. So that yeah, true. The second, again, if I ask this question in last 24 hours, how many times did you not have this dizziness? Again, what is the problem in this?
Did you not have?
Yeah.
Not
So again, you should avoid negatives. But again, in case of a scale development, you know that deliberately you put some negative statement just to check with the agreement bias of from the respondent. Because if the respondent is always answering like 4 5 4 5 4 5, and if you don't have a negative worded item, then that you might be reaching towards an agreement bias from the respondent ends. So you might have that. So if possible, you should avoid. If not, you like in case of a reflective scale, generally we have few negative worded item also. Again, next question, have you had headache before? What is the problem in this question?
before.
Yeah, very right. Before, because I'm not clear. What do I mean by this term before? Before means last 24 hours, last 1 month, 1 year, or what? Again, this question, have you had neuropathic pain before? What is the problem?
Neuropathic.
Yeah, very true, because neuropathic, again, it's a specific this thing, term which participants may not be able to understand. So you should not be having such word. So this was regarding the item development. We have talked, it should be, if it is a, again, through the literature search, you may take few items and then you may add a few more also. What you get from the after the interviewing process and after the focus group discussion. But again, the one thing is you should have permission. Even if you are using item of any other scale, you should have a written permission, because we don't have a very good experience regarding the use of scale without having permission. Means that we mailed but they did not reply and we thought that it is a yes, which was not. So then you have to determine the scale length. So now coming to the scale length, this is a very important topic to decide how much should be the number of questionnaire. So generally, you have to think about the from the perspective of respondents also, and you should weigh like pros and cons of having a too long question versus if the items are less, the reliability and validity will be low. So generally, we say that the total number of items should be 10 to 20. We will have this again. I will show it. Using the correlation term also, like as you increase the number of items, the the validity and the reliability increases. And generally it is, but if you see the 10 to 20 number of items are manageable for most of the respondents, especially if it is a self-administered form. And we have said that in the pre-testing and pilot testing, you should see that what is the time required to fill this questionnaire. It should not be more than 15 to 20 minutes. And then you have to review and revise the initial item pool. So we have it's again an iterative process. Initially you have got, like, let's say like what ANSI is doing, you should have many number of items, like let's say 100. That item pool is necessary, and then you can extract the relevant, like 25% or 50% of those items. So Renuka is asking for checking the agreement bias, how much percentage of items should be negative? No, I think there is no rule for that. But yes, if it is 25%, you can say if it is a 10 question, you can have 2 or 3 questions. If it is a 20, you can have 4. But I'm just saying out of seeing the scales. Generally, it has like 4 or 5 items. It may be more also, but I am not aware of any such rule, Dr. Renuka. Probably I'll look up into the literature if any rule is there, such rule. And then reviewing and revising initial item pool. So initially you should have like let's 100 item, and then it is generally said like you should have 50% more item than what is required. So if you are planning to have a scale of 20 to 25 items, you should have at least 50 to 60 items. But it is not a bad idea to having a big item pool, and then you can pick those items after a content validity, because you have to do the content validity of that initial item pool, and you will select only those items where the individual item content validity is more than 0.8. We will do that exercise. And then we have to revise this initial item pool. So till now we have either the translated version or modified version of a existing scale to fit in our local context, or if we are planning to develop a new scale, because there is no existing scale, then we have got an item of that existing scale. So now coming to the pre-testing and pilot testing, which we were discussing. So now what is a pre-testing and what is a pilot testing? So yes, one participant can read out this first scenario. Yes, can any volunteer to read this scenario?
Yeah, Doctor, scenario one, ma'am.
Yeah.
Dr. Patel is developing a new questionnaire to measure patient satisfaction in a hospital setting. She selects a small group of 10 patients who recently visited the hospital and asks them to complete the questionnaire. After they finish, she sits down with each patient to discuss any confusing or unclear questions, gathers feedback on how they interpreted the items, and make necessary revisions to the questionnaire based on their input.
Okay.
Next,
Thank you.
scenario two, should I continue, ma'am?
Yeah, please.
Scenario two, Dr. Singh is launching a new health intervention program aimed at improving diet and exercise habits in a community. Before ruling out the program to the entire community, he implements the program with 30 participants from the community. He monitors how the program operates, gathers the feedback on the materials and procedures, and assesses whether the program is effective in changing diet and exercise habits. Based on this experience, he makes adjustments before the full-scale launch.
So now you have to tell me which is a pre-testing and which is a pilot testing. Scenario one, first write the answer for scenario one. Scenario one is what? Pre-testing or pilot testing? So Dr. Ravi and Dr. Chetanjeet are writing. Scenario one is pre-testing. Ashwati is also writing, and pilot testing is two. So yes, so now have you understood the difference between pre-testing and pilot testing? We have discussed this before also, but yes. So again, pre-testing is about the fine tuning of the tools to ensure that you are measuring the construct very near to its true score. And pilot testing is regarding the rehearsal or a small scale testing of the entire process, so that before full implementation, you should be able to understand or know whether it will work on a full scale or not. So we first do the first do the pre-testing, and then again, after pre-testing, you have to go and you have to call a meeting with those experts and to further refine the questionnaire. And again, like I said, that if after this pilot testing, if there is an internal consistency is less or the content validity is less than the acceptable, then you need to restart the process again. So once you have got the final version of either the translated scale or newly developed scale, you do the pilot testing before final. And pilot testing, it is generally said that you generally it should be done on 5 to 10% of the total sample size calculated. So on 25, like in like one of our PG, the total was like 250 sample size, so we did it on 25. But again, 10% of the sample you can have a pilot testing. Now, the second question is many people they ask, like, especially from the clinical side, they say that is ethical clearance needed for pilot testing? So, what is your answer? Is it needed? Can you do the pilot testing without clearance, ethical clearance? Yes, you are right. You can't do the pilot testing before the. So now pilot testing, you apply this to 20 to 30, depending on 5 to 10% of the sample size. But you don't do, now you are not doing any factor analysis on this. So what is the purpose? So you're again, we have done this before also. You check the content validity and you check the internal consistency. And then what we do the next. So basically, whether it is a translated scale or whether it is a newly developed scale, we do the pilot testing. Now, again, if like somebody has asked this, like, do I need to, if even if it is a well-established scale, do I need to validate it still? So yes, answer is yes, because there are some contextual or the cultural difference. Even if it is a validated one, still you need to validate it. Why? Because there can be some cultural relevance. Like simple in this example, uh, here it is written, I often help people who are less fortunate than I am. So here the term help. So helping is like you can see, it can be a culture of many society. That helping is a culture. Since birth, they have been, trained by their parents in the school that they should help someone. So if it is there in the culture, you will not be able to understand that whether it is related to culture or whether it is related to the actual empathy of the person. The second is like if the scale item is, I sometimes find myself feeling tender, concerned, and compassionate towards people less fortunate than me. So, again, in case of a medical setting, also the same thing will apply, that if a person is in medical field, then of course you will find that there can be issues related to medical students, because many times they see people who are always less fortunate than them. If you are a medical person, generally the kind of patients every day you see, they are less fortunate than you. Means if you consider yourself as a fortunate, of course, it depends on your attitude also. So it has got a contextual relevance in the medical setting. Again, if the item is like, I find myself crying at the movies. If this is the STEM, then, and if you are asking this from, from this thing, gender, so there can be some gender issues, because if the male is answering this, then definitely they are not going to cry. So there can be some gender issues related to this STEM. Now, if you see the next uh, item, so sorry. I next item is, I enjoy listening to others' problem. So if you listen this, if you see this stem, this also tells like it is not sure. I enjoy listening to other problem. This is saying means they are. I mean, he or she wants to solve the problem, or he just wants to enjoy the listening part. So the language also, and the interpersonal interactions, that is also different. If the people there is a different, because the cultural context, the contextual context, that varies from one geographical region to the other geographical region. So now I think you have to do a item before we start with the next part. We have to start with one breakout room activity. So we have to generate item, means you have to generate item for this thing, for that empathy. And we have shared the
WhatsApp पे mail पे और वो demonstrate कर देंगे ये वाला size attendance
So this is the, we have shared this exercise on WhatsApp and over mail also. So you have to generate item for empathy, and empathy, the construct is the ability to understand and share the feeling of others. So you have to think about the observable behavior, about the feeling and situation. And it is better that if you don't copy because we already have a Toronto empathy and many other empathy scale.
toughness
But if you form any stem on your own, then I think this activity you can enjoy in a better way, because then you have to do the content validity of the scale. So now you can see here that the next is, these are some STEM. We have just given example. I feel upset. When I see someone in distress, I can easily put myself in somebody else's shoes. I often think about how my actions affect others emotionally. So in your daily life, how you feel empathetic, seeing the patients or talking to your housemaids or talking to anyone, the poor people who are living in the cluster area. So depending on your experience, day-to-day experience, whenever you have felt empathetic, you frame that sentence. That would be a good idea. I think we have shared the Google Sheet with them.
Google Sheet.
So we have shared the Google Sheet with you. I think we will give 15 minutes. 15 minutes time, 15 to 20 minutes. There will be a mentor for moderation also in each room. And how many rooms are we planning to open?
8 to 5 whatever room 5 to 6 room and then we open
So a 5 room, Dr. Anand, you open 5 rooms since we have got,
5 to
I
6
think,
room.
25 participants approximately. So 5 participants in each room, 4 to 5 participants, and one moderator or facilitator in each room.
You have to read the instruction also.
Instructions I will read for them.
It's a PDF read करने का.
Instructions is, again, you have to be in the small group assigned to the breakout room. Each group will act as a team of researcher task for brainstorming and generating.
वो पढ़ लेंगे.
This is the same, I think. So, Dr. Anand, can you hear me? I don't think, is he there?
Yes, ma'am. Yes, ma'am. I'm there.
Okay. I'm sorry, I couldn't listen to you. That's why I thought.